Dr. Vaccaro, why don't you run through a list of what it is that you treat at our practice?
So I am going to offer comprehensive gynecologic care, everything from a basic well woman, pap smears, birth control management, IUDs, all the way up to pelvic floor reconstructive surgery. And that includes anything from bladder Botox to sacral neuromodulation to vaginal reconstruction with or without hysterectomy. So comprehensive gynecologic care.
Now, Dr. Vaccaro, what are some conditions that you like to treat in your practice?
I really enjoy treating any quality of life condition that comes through the door. For me, that's bladder leakage issues, vaginal prolapse issues, vaginal laxity issues, pelvic pain, sexual complaints, menopause, management concerns. So anything that's holding you back from living your best life, quality of life, that's what I love to engage you on to make you live your best life.
Interestingly enough, the CDC just came out with guidance to say that women who get IUDs should be offered pain management. In 2024, it has taken the CDC this long to tell gynecologists that we should be doing pain management when it comes to IUD insertions. IUDs can be a very important part of birth control and perimenopause management. We love IUDs, especially hormonal IUDs, because often they don't stop ovulation and they are a great way to not bleed so heavily in perimenopause. So we often recommend our patients to get IUDs. Now, I am so grateful that starting September 2024, we have Dr. Christine Vaccaro, who is joining our practice. Now, Dr. Vaccaro is a very seasoned, retired military urogynecologist who has been practicing medicine for decades. And Dr. Vaccaro is very good at placing IUDs, and I am so thrilled to be able to start offering that as a service in our practice. And not only are we offering IUDs, but we're offering pain control and discussions about how we're going to perform trauma-informed, caring, and careful IUD placement. So, Dr. Vaccaro, why don't you tell everybody what is the plan for how we can just do better when it comes to IUD placements?
I love doing IUDs. There's such a beautiful procedure. It actually is very quick. However, it is not without pain unless we give a bunch of pain options. And there's so many different pain options. Anything from just a block, like local anesthesia, just to block the nerves that go to the cervix and uterus. There's topical sprays. And now, Dr. Rubin's office, we offer nitrous gas, which is also something that gynecologists should have been using way long ago, but hasn't been used full enough. So there's so many different ways that we can give pain relief, including other oral medications like ibuprofen, Motrin, Advil, Aleve to pre-medicate to prevent cramping afterwards, as well as anxiety medications for patients that are just not sure what to expect. So we can give something orally to relax patients as well. With that, though, you would need a driver home because you don't want to drive on things like Valium or Ativan when you go home. But so many options to make it comfortable, make it pleasant, so that you can get the care that you need without it costing you a traumatic experience, because that we certainly want to avoid.
And even if it requires going to the operating room for some light sedation, you are allowed to ask for that. When a man gets a vasectomy and says, I don't want to be awake for this, we let him go under anesthesia and nobody asks questions. You don't have to feel bad or guilty. We have a menu of options, and if an IUD is right for you, we're happy to discuss that as an option, but don't let the fear be the reason you choose to or not to do an IUD, because other kinds of birth control have other side effects, and having a baby has a lot of side effects as well. So if we can help with your birth control or perimenopause management, please reach out to our office. Dr. Vaccaro, what are you most excited about starting in this practice?
I think it's being around the team you've built. You've built an amazing team, wonderful interns, wonderful office staff, other providers. I feel already so welcome, so at home. Not only that, I've been given all the tools from our mini sexual medicine fellowship to be able to treat patients with the utmost care, respect, and time that they deserve. So I'm really excited to really connect deeply with patients, get to know them, make sure that what they came in for, they're getting answers, getting solutions, and they're getting the best quality of care they can.